Welcome, everyone. This is Sarah from CureSMA's Family Support Department, and thank you so much for joining us today. We would also like to thank our national presenting sponsors, Avexis, Biogen, and Genentech, as well as platinum sponsor Scholar Rock, for their generous support of the Summit of Strength virtual webinar series. We appreciate all of the questions we received in advance of the webinar and will try to answer many during these presentations. You're also able to submit questions throughout the webinar using the chat box, which you will find located in your GoToWebinar toolbar. Please note that all lines will remain muted during the webinar, other than for the speakers. If you have any additional questions after the presentation and the Q&A, you can contact CureSMA's Family Support team at familysupport@curesma.org. Now we would like to welcome our speakers, Tina Lewis, who is an educator for the past 24 years and an SMA mother, as well as Kimberly Cook, a special education professional and also an SMA mother, who will be presenting on managing the IEP 504 process during a pandemic.
Hi, my name is Kimberly Cook. I should have put parent of a child with SMA first, because I think that's the most important part of who I am. But I am also an inclusion specialist for Access Curriculum Together, and I'm an adjunct professor at the local university teaching students who want to be special educators. Next slide, please. This is Spencer, my son. He is 33 years old, and he was diagnosed at 11 months with type 1. That was 32 years ago. So since then, we have found out that he probably has type 2. He lives independently from my husband and I. He's a registered accessibility specialist. He is an artist, enjoys painting, and has recently been engaged to be married. Next slide.
Hi, my name is Tina Lewis. I too should have put parent of a child with SMA at the top because certainly that's how I'm able to have the discussions today with all of you. In addition to being a mom to my wonderful guy, Julian, I have been an elementary educator for the past 22 years in a variety of roles, including classroom teacher, reading specialist, and currently a literacy coach. In addition to that, I also support families and fundraise for our Chesapeake chapter of CureSMA, which represents Maryland and West Virginia. Next slide. This is my son, Julian. I was able to capture a pre-photo of him as his hair grew out during the time of COVID. So that's my favorite hairstyle there on the left. He's 16 years old. He lives here at home with me and his sister, who will be 13 this weekend, and my husband, Derek. And I will say, Julian has been an inspiration. He has empowered me and taught me so much about the importance of equity and in the school setting and honestly in our world. And you know, there are always, my belief is there are wonderful things that come out of not so good, and I am a better human being because of him. Next slide.
Today we're going to talk some about the special education process and what an IEP is, and how our current pandemic reflects the IEP process and the changes and modifications that we're looking at seeing. I know we have a couple Texas participants. In Texas, we are different than the rest of the United States, and we call the IEP an ARD. And an ARD is admission, review, and dismissal from special education. The IEP in Texas is just the goals and objectives. But I'm going to speak from a national perspective right now when I talk about an IEP. Next slide. An IEP is literally a contractual document, and it requires schools to provide services in the least restrictive environment to allow a child to make academic and meaningful progress. It describes the child's disability. It has the student's present level of performance, where the student is right now. It talks about educational services, school placements, and it has measurable goals and objectives. This law is called IDEA. It was established in 1990, and it requires or mandates equality, accountability, and excellence in schools for kids with disabilities. Next slide. The first thing that has to be done is an educational need needs to be identified. Just because a child has a disability doesn't make the child automatically requiring services. But an assessment has to be done first, and it must be done in all areas of suspected disability. So your child might have difficulties with fine motor skills, but also with speech, might have academic concerns. If those are your concerns, all of those areas need to be assessed. If your school does not suspect a need, but you do, you still have the right to request in writing the assessments, but do put it in writing so there is a paper trail. You can request an evaluation through your child's teacher, the school psychologist, your school principal, anybody within the school. You can ask for an assessment. Next slide.
And if I can just add on to that, Kimberly, as far as going with your gut, and we're going to address what this looks like very soon in the time of coronavirus, but if you are noticing things at home and you feel those need to be brought to the attention of the team, please know that you can still make that request. We're going to talk in more detail soon, but I think that that's very important during this time.
Yeah, the school district has 30 to 60 days to complete the evaluation, but I want to say don't delay now at all if you have any concerns whatsoever. I talked to several districts in Texas about how they're handling assessments during the pandemic, and they don't know. I mean, literally, they don't know how they're going to assess kids. So when they do, and there's really no law because the law is not written for a time during a pandemic. But I do think the schools are doing their best to figure this out. But go ahead and request that assessment as soon as you have the feeling an assessment needs to be done. Don't delay. When you get the assessment results back, and you will get a copy, you need to thoroughly review it before your IEP meeting so that you have time to internalize the information. The school will be required, if your child is eligible for services, to do a re-eval every 3 years. The IEP is reviewed annually, if not more often, but it can be modified as your child's needs shift. And next slide, please. And there's a 3-step process to developing an IEP. You have to identify the educational need, goals and objectives need to be written, and services need to be provided. Next slide, please. There are several steps to developing an IEP. The present levels of performance need to be developed, and that's just in all areas. The document needs to say where your child is and where they're performing at the current time. It has to address your child's unique needs. And the whole point is to provide a free, appropriate public education. And you'll often hear that acronym is FAPE. But the key here is during the pandemic, even if the free, appropriate public education has to be provided, even if it's in a digital environment. It's not just at school, but anywhere services are being provided, it has to be free and appropriate. Goals and objectives are developed to measure progress, and modifications or accommodations are listed to help your child perform in the least restrictive environment. So if they need like speech to text for accommodations because they have a difficult time writing, that would be listed in the IEP. Next slide.
So now we're going to talk a little bit about what a typical IEP meeting would look like in a brick and mortar scenario. And then later in our session, we're going to talk about what it looks like during the current pandemic. Next slide. So who can participate? And this actually applies to an in-person meeting or a virtual IEP meeting that we'll discuss soon. So these guests must attend. That would be the special education teacher. In some districts, that could be your case manager. For me personally, the case manager for Julian has always been my go-to. And so they are my point of contact in the school setting with regard to everything that has to do with his disability. A district representative or administrator, this is critical. And I can't tell you how many times I've heard that the meetings are occurring without representation from administration. And I would highly recommend having an administrator in these sessions with you. So often when I'm thinking about the school as a whole, my communication has gone to the case manager as well as the administrator, because we have to think about our children and the entire school building. The person who actually assesses your child in all assessment areas, so if they're given multiple assessments, you would want to make sure anyone who assessed your child is available. The general educator, so that would be the classroom teacher. As my son started secondary programs in middle and high school, typically he has about 7 or 8 teachers. So one teacher would come with the perspective of all teachers. That does not mean, however, that you might request, if you have specific circumstances in multiple classrooms, you could certainly request that additional teachers, classroom teachers come. And of course, you're invited. So these same people are attending the IEP meetings that we're having now, and we'll talk a little bit about what that looks like. Next slide. These are guests who can participate. Julian actually started participating in his IEP meetings during 8th grade. I know certain families have shared that their children participate even earlier. There were certain conversations prior to 8th grade that I wanted to have with the professionals, and when I felt that it was appropriate, we would definitely involve Julian in the decision making. A school psychologist, an adaptive PE teacher. I will say with every IEP meeting that we had for Julian, we always had an adaptive PE teacher available. Speech language pathologist, an OT, a PT, and oftentimes a friend or an advocate or even a family member. It's oftentimes like going to a doctor's appointment and you're getting ready to hear a lot of information. It's a lot for families to take in. And so sometimes it's always helpful to have an extra set of listening ears. Next slide.
Okay, let's talk a little bit about goals and objectives on the IEP. Next slide. The critical part here is that the objectives have to be measurable and they have to be reasonable. They also have to mean the same thing to each person that reads the goal. It has to contain what the child will do, and 2 things that are important is the criteria, what measurement will say, yes, the child has mastered the goal, and by when the goal should be completed, by the end of the year, within 6 months, that kind of thing. Next slide, please.
So if I can add on to that, Kimberly, these goals and services are, and we're going to be talking about it soon, if you look at that last goal, the last goal was actually a goal set for Julian, and it involved the use of his wheelchair, doing wheelchair push-ups. So that is certainly an attainable goal that he can work on from home in a virtual setting. So just keep that in mind as we start to talk about the impact of goals and services in a home setting.
Okay, I put this was a goal I feel like Tina came from you as a Julian's goal, and it had under frequency, periodically. And I have a really hard time with periodically because in my situation with my son, the school would think periodically meant every 6 weeks, and I thought periodically meant every day. So just be sure your goals are very, very clear so that they mean the same thing to you as they mean to the school. And these goals, when we talk about reasonableness, need to, if your child is getting services at home during the pandemic, that they have to be attainable within your environment. Next slide, please. We also want to talk about a 504 also. I know some of our students are not in special education, but are in 504, and these same things apply during a pandemic. The 504 services still need to continue. And next slide. But a child is eligible for 504. It's really a civil rights act giving equity to children with a disability. So it can be any child with a physical or mental impairment. The impairment has to affect a major life activity, and it has to substantially limit the child as compared to their peers, average nationwide. Next slide. And 504 gives equal access through accommodations and services. Typically 504 is not funded, so it has to come out of a local budget. So you typically don't see occupational therapy and physical therapy, although those things can happen. It just depends on the district. But traditionally it's more easier accommodations and services like oral testing, giving an elevator key to a child who can't use the stairs, giving the child accessible instructional materials or note-taking assistance. Next slide. Oh, but remember that those services do have to continue during the pandemic.
So it's important to, when Kimberly and I planned this session, if any of you have seen us present before, a lot of the information that you just heard was perhaps a review. We felt that it was important because much of what you just heard is applicable to the greatest extent possible in a virtual setting. So we're going to talk a little bit about, many of you, including myself, are having to make a decision about school during this unprecedented time. So we're going to talk about some of the things that considerations the CDC has provided, as well as the Department of Education, and then I can give you some of my own thought processes that I'm going through right now as we have to make a decision for Julian by this Friday. Next slide. So this information actually comes from the CDC, and it's not, any of it is not really surprising. We know that the lowest risk for all children, and especially ours, would be virtual only classes, activities and events. More risk would be a hybrid model, and schools are interpreting the hybrid model, districts are interpreting the hybrid model in different ways. Ideally, more risk would mean that your child is going to school perhaps 2 to 3 days a week and is spending most of the time with the same group of students. So my son's school is currently offering the option of a hybrid model in which they have established 2 cohorts, creating smaller groups of students in the classrooms. So it's not the lowest risk, it's somewhere in the middle. And of course, the highest risk would be a full return to in-person learning with full classroom sizes, not considering social distancing. Some schools I've heard are proposing the option of wearing a mask. And again, even sharing materials can be a concern because we know that for 24 to 46 hours, materials could have the presence of the virus on them. Next slide. So please keep those principles in mind as you're making a decision, and those are the principles set forth by the CDC. So virtual, hybrid, or full return, there really isn't an easy solution, and our hope is that out of today, some of the suggestions and thoughts that we have for you might help as you make that decision. Next slide. So when you're thinking about this decision, you're really weighing all of so many different options. And one of the things that will help you as you try to make this decision is, what are the benefits to my child's return to one of those options? What are the risks? We know that there are risks. You know, I get nervous even just going out to the grocery store each day. I had to take my children to a very delayed orthodontist appointment today, and there are risks, but there are certain communications that we put in place to ensure safety for our children. And then feasibility. Many of you, my husband and I are both working parents. What are the feasibility of the options that you have, if you have options? Even if your school has decided to go all virtual or hybrid, you of course have the option to homeschool. So benefits, risks, and the feasibility of the options are the three main categories to think of. Next slide. So these two questions to me are at the forefront of a decision. One being, what is the risk of my child not returning to school? So there really isn't an easy answer like we had talked about. But one of the things I'm thinking right now as a parent is, by not sending Julian into a hybrid model, what are the risks of him not going to school? And we're going to talk about two of them that come to my mind right away. Next slide. So one would be, you can see him there. He's been really advocating for himself to try and go for a stroll 1 mile per day to stay physically active. But I know in my heart, honestly, manipulating a high school campus, he's probably getting more physical activity. The second main piece that I'm thinking about is his social interaction. In a sense, we've leveled the playing field because Julian is still socializing with friends, but it's in a virtual format, which hasn't been a drastic shift to how he communicated prior to the closure outside of school. He spends a great deal of time with friends online. However, he's not getting that same level of social interaction in this as he does in the school setting. And so that is a concern of mine. And Kimberly and I were just talking about, you know, social interaction is not just that socialization, right? Our students our children are working on communication, language skills. It goes well beyond just that social interaction, and it's also impacts their emotional well-being. These are two major areas right now that my husband and I are focusing on for our child, and it's something to think about for your children. Even though Julian is getting physical therapy in a virtual setting each week, is it giving him the same level of physical activity that it would during the school day? Next slide. And then there is, of course, as we try to make the best decision for your child, what is the risk of my child returning to school? And that, of course, has an obvious answer, because we know that our children are more at risk and do have compromised situations to take that risk. And I was explaining to Kimberly, I recently heard a pediatrician speak about, you know, as you are making this decision for your child, we are in unprecedented times. We're traveling uncharted waters, and we've never been here before. And right now, we have to do, there isn't necessarily a right or a wrong decision. We have to do what we think is best. And so we're again looking at the risks, the benefits, and the feasibility of all options. Next slide. So one of the things that my husband and I are actually attending a Zoom meeting with his school tonight. And one of the things that we need to continue, we're all advocates. That's why Kimberly and I are here today, as we continue to advocate for both of our children, regardless of how old they are, because we want them naturally, and Spencer's already done that, to continue to advocate for himself, and Julian is definitely starting. So it's important to review your school's plan for safety and healthy learning environments. What are they doing to ensure social distancing? Not just in the school setting, right? As they're walking from class to class, as they're traveling on the bus, what precautions are being put in place? And the key question is, how are they being monitored? So I can have a beautiful document that lays out a plan about how my school is going to ensure a safe environment, but how will that safe environment be monitored? How will I know that when my child leaves that classroom and goes to another classroom, and that the classroom has been sanitized, that the desks are certainly going to be at least 6 feet apart? So what's in place? How's it being monitored? Next slide. And just like we talked about, how are things being maintained to ensure a healthy environment? How will the school maintain healthy operations? So I spoke to Julian's school, in which they're setting up 2 separate cohorts to keep the groups smaller. One of my questions tonight is going to be, will that cohort travel together? Because if it means that he's going to be entering a classroom with a different group of students for each of his 7 classes, that becomes more alarming to me, right? I'm increasing his risk of infection. What are the school's plans for when someone gets sick? So, you know, we've already heard some stories nationally, how schools have had to shut down. And so what are those plans in place, and what happens if it's just my son's class, and what will that look like? So if he leaves from a hybrid situation into a virtual situation because someone has gotten sick, what does it look like? Next slide. So as I was exploring, trying to make my own decision as a parent, the CDC has this wonderful checklist that is available. You can either go to cdc.gov or actually Google back to school decision making tool. There is a section for children who receive support services. This is a great tool just to help you think about the entire situation and how it applies to your individual child. Next slide.
Okay, let's talk about the IEP process and what it looks like now and how different it is from the past. Next slide. Communication during the IEP process these days is virtual. In the best world, parents have access to internet and computers and can access Zoom meetings, email, that kind of thing. Parents can also participate just through the telephone if that works for them. But IEPs can be very, very long. So parents can take that IEP digitally and print it out themselves to review, or review it on their computers. Parents can also request the school district provides a hard copy of the IEP so that it can be mailed to them. But we're really looking at flexibility in all this because communication just is not going to be in person. Some parents, I know in our area and around the country, do not have access to internet or computers. And the school districts I talk to here in Texas actually provide a space for the parents to go to, maybe in a different part of the school building where they have internet access and are provided a computer. But they're still keeping the families and educators separate physically during the IEP meeting. Next slide.
So can I add one thing, Kimberly, as far as, first of all, I would highly recommend having a hard copy of the IEP in your hands if possible. If printing it from home is not possible, You can certainly request that they send you a hard copy through the mail. Just know that many educators are not in the school buildings right now. And if you do make that request, it could extend the timeline a bit, but it could be worth it. If you're like me, I like hard copies and I like to highlight, I like to ask my questions, I like to process the IEP on my own. But please know that that's an option. It just could take a little bit longer than having it sent to you electronically.
Okay, one part of the IEP meeting is when everyone comes to consensus and agrees on the processes and the objectives and the services a child will be receiving. Everyone at the meeting signs the document. In a virtual world, that makes it a little more difficult. You can, as a parent, print just the signature page, sign that, scan it, and send it back to the school, or even send it back during the regular snail mail. You can take a picture as a PDF on your phone and sign it electronically that way. One district I talked to actually asked the parents if they can add a digital signature to the document, and then the parent verifies that through an email that they agree with the IEP document. So you just have to think outside the box here on how to actually sign that document, and I think different schools will try different approaches depending on what access parents have to digital access. Next slide.
So we spoke a little bit about who will be there, who will attend these meetings. This is actually an IEP meeting that I attended in my own district. You still want to ensure that those key people are there. I'm searching real hard to find the silver linings of this unique time period, and one of them is I think our IEP meetings have become more accessible. So just think about me actually inviting a friend to come in. It's a lot easier now because we are in this virtual setting. One note is that in my district, we were able to have our cameras on for the IEPs, which was invaluable because it's so important to, of course, see the faces of the people you're working with, the team and the parents you're working with. However, I did speak to one district, and because of the bandwidth with internet, actually being on camera consumed a great deal of that and actually pushed people out of the meetings. So it varies district by district, and that's just something to keep in mind. Obviously, we want all stakeholders in the meeting, and if it just means hearing their voices, then that's the way it would need to proceed. But that depends on the internet service.
Next slide.
So as I spoke to you earlier about equity versus equality, I've learned so much in my efforts to advocate for Julian and also working with other families. This image always comes to mind for me, and this applies to any setting. So when Kimberly spoke earlier about free, appropriate public education, we are working hard, and school districts are working hard to ensure that we don't have any barriers. So in the first image, you will see that everyone is getting the same thing. It's fair, right? It's equality. Everyone's getting the same thing. In that second image to the right, everyone is getting what they need to successfully watch the baseball game. And in the third image, we've eliminated the systemic barrier, and that is our goal in a brick and mortar setting and in a virtual setting. And I just say that, like I said earlier, districts are working diligently to think about what this scenario looks like for our children who have unique needs from home. Next slide. So I want to go over some of the guidance that's been provided from the Department of Education, and I think that this will hopefully answer a lot of the questions that we've received. So the laws of IDEA and 504, as Kimberly stated earlier, do not address a situation in which schools are closed for an extended period of time, and that would be beyond 10 days. And so I have really, that has resonated with me. This is a whole, like we've talked about, uncharted waters that we're traveling right now. And because we haven't been here yet, everything hasn't been thought through, okay? So that in Maryland, we had 2 weeks where schools were just closed. And during that time, if children who in the general public education, general student population are not receiving services, children with IEPs will not receive services, okay? That is full closure, okay? If we are in a virtual setting and the general student population is receiving services, then our students with IEPs will receive services, okay? So I think it's just, I want to clarify between what closed means versus virtual. If a school district is providing educational opportunities to the student population, general student population, they must ensure that our students with disabilities have equal access to the same opportunities. And that means they must follow the provisions set forth by a free, appropriate public education. Next slide. So I looked carefully at the language written by the Department of Education, and I just want to read this because the highlighted section phrase is what we really need to pay attention to. Schools must ensure that, to the greatest extent possible, each student with a disability can be provided the special education and related services identified in the student's IEP developed under IDEA or a plan developed under Section 504. I want to really highlight to the greatest extent possible, because as an educator, I can tell you that we have some students who receive services throughout the school day. And in a virtual setting, it's sometimes not realistic. Okay, and so we're going to talk a little bit more about that language. Next slide. So here are some of the things that school districts are doing to meet this. So when they start to look at, our case managers and school teams are starting to look at a child's IEP, they're really taking into consideration to the greatest extent possible. So we're doing everything we can to try to meet the goals and objectives outlined on a child's IEP. Families can choose to amend. So some school districts have offered the option to amend the IEP so that what is laid out on the IEP can, those goals and objectives can be reinforced from home. Remember that some students have many goals and many objectives. So our special educators have worked diligently to determine which goals and objectives can we really meet to ensure that we've set this child up for success. Given the nature of what is happening right now during this pandemic, amending an IEP, if you think about IEPs that were written in the winter and reinforced and goals were set for the spring, if we were to amend that IEP, we could be amending it. I mean, in the state of Maryland, we were closing for about 2 weeks and 2 weeks at a time. So, and now we're at the point where we're doing virtual through January. So having to amend an IEP frequently just may not be realistic. Some states, and in our state in Maryland, we are offering the option to develop, districts were offered the option to develop an individual continuity of learning plan, which means that they would meet as a team, the parents and other critical, the case manager and other classroom teachers would meet as a team and decide which goals on this IEP can we continue to reinforce from home? And that was what was laid out on this ICLP. That could vary depending on the state, but these were the options that our state provided. OT, PT, speech, adapted PE services can be provided, but not in a student's home. Those services can be provided in a virtual format, but occupational therapists, physical therapists will not come into your home. You wouldn't want that risk, and we also have to make sure that we don't put anyone at risk. So services can be offered, it would just look different. Currently in our school district, our OTs and PTs are really working diligently to think about how they can get equipment into our students' homes, how creative they can be in a virtual setting. And I can tell you, just with Julian's medical PT, it has evolved and it has become quite wonderful, because with experience, he's doing much more of the work now, but in the beginning it was new. And just keep in mind, as you're pursuing OT, PT in a virtual format, their focus is always going to be on what that child's goals will look like to access the school environment. So it is not medical-based PT. It will be access to the learning environment. So the goals that they will continue to work on will help your child as they return to the school setting. So walking up and down stairs, manipulating crowded hallways, and those are things that they can still work on in a virtual format. Next slide.
Okay, let's talk a little bit about compensatory services. Traditionally, compensatory services are future services to be provided for a student to make up or compensate for a school district's failure to provide a student with appropriate services in the past. But now we're looking at access to services that the child cannot receive, like Tina was just talking about speech and OT. So some school districts are looking at compensatory services in the future, which is, I mean, there's no guidance for this. Once again, school districts are just trying to figure out how to talk about a child's regression because of lack of services without seeing is a more anticipation of regression if the child does not have access to the school environment or to the services to help them navigate that environment. Next slide. Compensatory services, it doesn't mean that automatically if your child did not get 60 minutes of physical therapy a week for 3 months, that they will get those services minute for minute when the brick and mortar building opens up. It's not quite that easy. Some districts look at data in retrospect to determine services. If the services can't be provided virtually, they are looking to see how it might harm your child as far as progress or hinder their progress. So the consideration is based on what the student is missing and what their needs are now and will be in the future. Next slide. Once schools are in session again in their actual buildings face-to-face, the IEP team can reconvene to determine if compensatory services are needed. But those services are based on the child's progress, based on the established goals in the original IEP. So if your child has made his targeted growth without the services, then compensatory services would not be necessary. Next slide. So some examples of compensatory services, the duration of services can be extended, the frequency could be increased, additional resources could be provided that weren't even discussed in the original IEP, and we might look at alternative resources to be recommended once in-person learning resumes. But it's important to remember this is an individual consideration for individual students. It's based on their individual goals, and the regression or lack of progress a child might experience once he goes back to school. And once again, some districts, one district I spoke to, they're going to address compensatory services after the fact to see if the child has not made satisfactory progress. But another district was looking at it ahead of time, which I thought was lovely. But once again, there are no guidance. Schools are just trying to determine how to best serve the kids. Next slide. And one option we talk about and parents ask about is homeschooling. You can choose to homeschool, but in order to receive special education services in a homeschool environment, the child needs to be enrolled with the public school, even if it's for part-time. So you need to talk to your school district about access to services if you choose to homeschool. And this is different than virtual learning through the district. Homeschooling would be the parent taking responsibility for educating their child. Next slide.
Okay, so we're going to talk a little bit about assessments, and like everything that we've talked about today, our schools nationwide are working diligently to try to figure out what this is going to look like during a pandemic, because if you even just look at the image there, there's something about, you know, sitting right next to the child to complete an assessment, sharing materials. So they are continuing to think outside of the box. I know in our school district, we did attempt to do some summer assessments. It has been complex. It has been complex because of the need to use materials to ensure that the materials are sanitized, the need to work with a familiar face. So oftentimes, you know, it's a lot for a 5-year-old to sit next to someone for an initial assessment who they've never met before. So, and of course, we want our children to demonstrate all that they do know in a comfortable setting. Currently, students are being referred for assessment. So I was actually in an IEP meeting where we did determine that testing was necessary. We documented that the testing would be done. When that testing will be done is to be determined. So everything, unfortunately right now, some things or many things are on hold. And please know that our school districts continue to try to think creatively about how we can move forward with these assessments. That doesn't change the fact that if you are seeing something at home and it is a concern, please communicate with your case manager or the classroom teacher so that it can start to be scheduled. We at least, and I would imagine that it's going to come down to a timeline of which assessments were ordered or which assessments were referred first. So if you have an assessment to be done on the books, then I think that that would be a proactive thing to do. Next slide. So our message is, and you've probably heard both of us share this before, is to continue to educate and advocate. It's a little bit harder right now because we're educating ourselves on what is going on during this pandemic. So as we educate ourselves, it continues to be important to educate the educators and to continue to advocate for our children's safety and well-being. Next slide. So one of the things I've learned very quickly for the past 13 years is to be proactive and not reactive. I can tell you that the few times that I have made assumptions that my child's school, and I will tell you Julian overall has had a wonderful experience, there have been instances where I have thought they've got it this time. And when I have made those assumptions and I have not been proactive, something has gone wrong, and it could be the smallest hurdle, but the smallest hurdle for my son could be the biggest mountain for him. So be proactive, not reactive in this time as well. Next slide.
And one of the most important things to me, being a special ed director in my past, is the importance of communicating openly. So often I didn't know what a parent was feeling or their child was feeling, and they were making assumptions. I think it's just critical that you express your fears, your concerns, your hopes, whether it's through email or through phone calls. Just be sure you're not hiding or being intimidated by this whole process, because the school district can only do for you what they know about. Next slide.
So now more than ever, Julian's educators, when I interviewed them years ago and asked them what they feel like educators should consider as they work with children with SMA, they said, think outside of the box. His adaptive PE teacher used those exact words. Now, more than ever, during this pandemic, our educators and we as parents have to think outside of the box. There are really, this has not been laid out in print. So we have to maximize our children's opportunity during an unprecedented time. Next slide.
And most importantly, follow your heart. I think there is no right answer to a lot of these questions. There's just a better answer maybe, or a best answer, but follow your heart. You know what's best for your child and what for your situation. But just get as much information as you can, equip yourself with knowledge and with relationships, and follow your heart. Next slide.
And I can add on to that. I just spoke to a dear friend of mine who also supported me immensely in Julian's educational experience. And I explained to her what we're having to consider for Julian. And she said, you know, Tina, if it makes you sick to your stomach to think about Julian going to school, then don't do it. And
So
I think
follow
that,
your stomach.
what did you say, Kimberly?
Follow your stomach also.
Follow your stomach and your heart.
And I would like to encourage you all, this is our contact information, and I know this is all a new situation, and as things come up and situations change, Tina and I are both available to answer questions, to listen, so do feel free to contact us.
Thank you so much, Kimberly and Tina. So we received a number of questions, but I think we're just going to pick one that we want to answer and clarify a little bit that came in from the community. So the question is, my student always has an IEP, so we're not familiar with the 504 process. How does the 504 apply at the college level? What does my student need to do for these provisions?
Excellent question. There's college campus, there's a disability office, and in college, your child is responsible for advocating for himself. The school, and like in public school, the school is responsible for providing services. But the college level, your child will have to go to disability services, take their 504 paperwork from their previous school district, and your child will actually tell this disability service what kind of accommodations they need. And it works. I mean, and I teach in a college setting and it works well. You just have to be sure that your child's advocating for himself, and pushes forward that and makes the appointment to go to the disability services office.
So right now, my son currently has an IEP, and as he prepares for college, we'll have a transition meeting, at which point we would establish a 504, and as best as possible, find a college that is able to meet the needs laid out on his 504.
Yeah, that's a good point, because the IEP no longer has any validity in a college setting. It's just a public school setting. So 504 takes over as an adult.
Perfect. Thank you for that answer. And thank you again, Tina and Kimberly, for that incredibly informative presentation.
We appreciate everyone who joined us today on today's webinar. You'll be receiving a follow-up email with a survey link, and we welcome any feedback that you would like to share with us. We are also so thankful for the incredible support from our sponsors for making the Summit of Strength virtual webinar series possible. If there's anything that we can do for you, please do not hesitate to contact us at familysupport@cursma.org. Have a great day, everyone.